Did you buy a scraper tool thinking that you must need this for your recovery and now you're not exactly sure what to do with it? Well, I'm about to help you out. At Mobility Doc, we carry the sidekick tools. So we regularly use the Swerve and also the Echo. Myself, I use the Swerve at home every day. I actually use it in the shower, believe it or not. So when my legs are all soapy, then I go through my legs. Well, what I'm gonna do is I'm gonna show you guys my daily routine that I do for muscle scraping. So I'm gonna go over the quads, hamstring and IT band, and the calves. This is my go-to. I spend about 8 minutes or so in total working through that area, sometimes a little bit less. It's going to help to increase blood flow to that area, which is going to help with the repair process. So whether you have an injury or you're trying to prevent injury, having some type of scraping routine is really helpful for facilitating the recovery of those muscles. Now, the thing though is that I have patients ask me all the time about like, how do I use this, right? So what we're gonna do is we're gonna go through a little bit of what to do, but then also some tips and tricks, right? Keep in mind that I have done this scraping technique for thousands of patients at this point. So I've learned a few things along the way and I want to share them with you. The really cool thing about the Swerve is that it has all the sides you can use for different parts of the muscle. So this part that is more concave, that's really good for going along the contour of a muscle and it kind of hugs it. Versus if you want to go a little bit deeper, then you use the convex portion. So then that is going to be helpful for getting to that area that's a little bit deeper. Then the thing that's pretty cool then is that it has these like more kind of like pointier kind of edges that aren't sharp, but then you can kind of get into some like harder to reach areas. So I'm going to share some tips with you guys that I've learned over the years of what I find to be most effective with my patients and then also for myself. All right, so let's get started. We are going to go through the quad. We're going to go through the IT band, the hamstring, the shin, and also the calf. I'm going to show you a few ways to get to those muscles and then also give you an idea of how long you should do it. Generally speaking, you want to do the muscle scraping for about 1 to 2 minutes per area before then moving on to another area. For a larger muscle group like your quads or your hamstrings, you could spend a little bit more time, but I'll go through all that. Now, a general rule, if your leg is in a more relaxed position, you're going to be able to get to the deeper part of a muscle versus if your muscle's more contracted, you're going to get to a more superficial area. So if my knee is bent, then I'm gonna get to the more superficial part of my quad versus if my knee is extended, I'm gonna get to the deeper part of it. Now, I'm not going to use any type of emollient or lotion just because I have these shorts on. Now, obviously though, if it's like after a run, I'm wearing shorts and I'm using lotion, or like I said, I do this when I'm in the shower, right? Because I'm crazy. So it's like, I will like, you know, my legs will be all soapy and then I'll kind of go through here. Now, in this case, I'm going over pants, but this isn't actually ideal, right? So like, I wouldn't recommend this as this is the standard of what you should do. It's better than nothing, but it's much better though to use some type of emollient or lotion and to be skin on with the metal because it's gonna help to kind of get to more of those fibers. Now, that being said though, we're gonna do with this what we can. Now, first, what I like to do is I like to start with the more rounded edge here, okay? That concave, and then I start going through at an angle, so at like a 45-degree angle. And Dr. John had explained a lot of this before, so I won't repeat myself too much. Make sure to check out that video. But in terms though of this quad, you see how I'm kind of going through this inner portion, through the center, and then kind of all along the side. I'm gonna spend about a minute or so doing that. Because these muscles are big too and you need a little more force, you see how I'm holding it on either side here? So then I hold it on either side at an angle. And what I'm doing is I'm at an angle where it's kind of facing toward me a little bit, because then I can it's almost like I'm kind of pushing everything up toward my body, okay, toward my center. And then I'm gonna get to this part of my quad. Now, like I said, if you want to get to a more superficial area, you'll feel this a little bit differently. Then I like to go on my knees and then I'll kind of come around here like this, because then I can really feel this along this part of the IT band in that part of the quad. And don't go over the bone, but you can come just above that. So if you've had this nagging patellar tendonitis and you know that this part of your quad is tight, this is really useful to do. The other thing that I'll do, I'll come on my knees and then I'll get to this area because now my hip is extended, so that muscle is on stretch a little bit more and I can get to this deeper portion. And then make sure to do both legs. For this IT band hamstring area, I like to do this first starting in this kind of bent position. So now you see how my hands, I hook this hand underneath my leg. So that way then I can kind of come to that side. So then I'm kind of pulling the scraper into me as I'm coming through, versus here it's a little bit harder if I'm just doing it with one arm. So then here I like to do it with both hands, just like this. And I'll first start with it on that more concave side, and then I can go to the convex area. So I'm kind of coming just underneath here. So this is kind of right where the quad and hamstring meet. The IT band goes over top of that, and I'm coming through here. The other area that gets particularly tight is kind of right around this greater trochanter. Don't go over the bone. You can go just before that. The other thing that I'll do to get to that area a little bit more is I'll cross my leg over and hug this leg in. Then that way I'm putting that muscle on stretch. So in that way then I can get to this whole area here. So I'll come all around the side, just like this. And again, for a muscle group, you want to do it for 1 to 2 minutes or so. While I'm down here, I'm going to work on the calf. The calf is sometimes a really difficult area to get to, just because it can be hard to get to the deeper portions. Now, what I like to do is that same idea of using the my two hands, and you see how first this muscle is just in a relaxed position, because then I can kind of get to that deeper area, kind of all underneath here, just like this. But then I can get to the more superficial area by bringing my toes up toward me. Oh boy, this does not feel good, but this is necessary. Okay, so then I can kind of get to here. So you can do a minute with the foot in dorsiflexion, and then a minute with the foot relaxed. The other way that I like to get to this calf is that it's a little awkward, but I'll come in this kind of kneeling position, and then again, like I'll hook my hand behind, so in that way then I can get to this whole area. And it just gives me like a slightly different leverage point than when I'm here. So give both a try, see what you think. Now, for the shin and this peroneal area, here's that anterior tib and your extensor digitorum that comes all the way down into the foot. Don't go over the bone, okay? But it's really helpful to get to this shin and this peroneal area. So it's gonna come into the side here. So you notice how I'm still at an angle, just like this. I'm gonna come through, all the way through, just like that. And again, I'm trying to get to that area for a minute. Then I'll flex this, come up in through here, all along the side. Don't go over the bone. You can come just below here. And then make sure too that you come, like, find these bony areas, don't go over them, but then go to the part though that's just below it. Here's where using the little tip can be really helpful, because a lot of times this part of this anterior tib gets really, really tight right at the top here. So if you're having shin splints, if you're having some type of what feels like an ankle impingement in the front here, actually sometimes even when people have, when they're getting like patellar tendonitis, and also sometimes even some IT band issues, this area in through here will be super, super tight. Then what I like to do is I like to do something that's like, that's a little bit more knee specific. So you can come through and get to this patellar tendon. So just below this part of the knee and and then here's where using that little tip is going to be really helpful. What is also helpful too is like, see how I'm kind of pulling this skin up to make it more taut? I'm using this hand and kind of pulling that up. That's going to be helpful for getting to those deeper areas. And then you can kind of come along this part of that IT band, kind of come underneath here a little bit more, all through there. So using this little edge is what's really helpful for going around where all the bone is and that hard to reach parts of that muscle. Now you can get to the hamstring a little bit more deeply if you're standing. So then I'll come through here, because if my knee's too bent, then I might not feel it as much. So then I'm coming all along this side area just like this, coming just below, just to this like upper portion of where the knee is, and I'm kind of coming in through the side. So you see how it's like I'm kind of moving all the way up in through that inner thigh, along the side, down in through here. And then I can also vary then how much I'm bending and straightening my knee as I do that. So just nice and slowly bend and straighten my knee as I do that. I like to do that same thing then too with my calf, where it's like I'll bend and straighten my knee as I do that. Introducing some movement to that area will help to challenge that flexibility a little. Make sure to scrape each muscle group for about 1 to 2 minutes. If it's a little bit of a bigger muscle, then err on the side of 2. You can even go up to 3 minutes or so. But make sure to move all around that muscle. So even if only one part of it hurts, it's really beneficial to make sure you go through that whole muscle. The other thing is that you want to reduce friction. So use lotion, some type of emollient, or if you're in the shower, make sure that that your legs are nice and soapy. So then that way then the metal can be the thing that's gliding over your leg, and then it's not like you're just breaking blood vessels because your skin's too dry and it can't do what it's supposed to. A few do's and don'ts. So Dr. John went over a lot of the protocol for muscle scraping in another video, which we'll link. But just to go over again, remember, this is not for open wounds. You can still kind of go around it, but the point is not to go over top of it. The body's doing what it needs to help with that cut, scrape, things like that, but don't use this over top of it. The other thing too is that with like swelling and bruising, it's a proceed with caution sort of thing, right? So I can't give you a blanketed statement of absolutely yes, do this, no, absolutely don't do that, because it really is pretty nuanced. So if you're not sure, physical therapists are the ones that they know how to use these tools, but in the context of what your clinical picture is, right? Now, if you've already been recommended to do this, then by all means do it. But remember, like, this is one part of a larger equation. So if you're unsure about how this fits into your recovery routine or also in treating your injury, it's best to talk to a professional, right? It's best to talk to the person who has a really clear idea of that whole clinical picture and when it makes sense to use this. The great thing about muscle scraping is that it can be used to treat an injury and prevent injury. So I showed you my routine that I do as a preventative measure, but these are also the techniques so that you would use for if you're working on a muscle, like say you strained your hamstring or you strained your calf. This is exactly what you would be doing. It's the same protocol. Guys, give this a try. This is something that I'm always telling patients about, these different ways that I go about getting to some of these muscle groups, because I've tried them myself. I'm constantly treating myself. So if I miss something, let me know, because I want to learn from you guys too. Or in the comments, leave a comment about some area that you didn't know that you should be scraping and now you're going to try. Let me know what you think once you try this. Make sure to comment below and like and share. I know you runners. I'm sure that you run with someone who would really benefit from seeing this video, so make sure to share it with them.